All right, hey everyone, let's see if we can get this show on the road and begin our discussion today, talking about multiple choice question strategies as well as test day strategies. Try to make the most of your test experience. We'll see if we can get everyone out of the waiting room and here into the session with us. As you tune in, if you don't mind, head over to that chat box. Those of you, I'm sure most of us are familiar with Zoom. Head over to the chat box chat feature and send that. Make sure it's going out to all panelists and attendees. And we'll do a quick sound and video check as we begin to make sure that we're broadcasting loud and clear. Awesome. We got broadcasting loud and clear. Thank you so much for joining us. Really appreciate it. Today, our whole goal is to talk about how to make test day as pleasant as possible. The slides are posted in, those of you who are part of our crash course as well as our full live course, I've posted the slides. Those of you who are here as guests today, I'm going to go ahead and post this, the link to the notes over in the chat box. So I'll go ahead and post those. You should be able to see those here in just a sec. All right, so the slides, you can download those via that Dropbox link I just pasted into the chat box. Appreciate you spending the time with us here today. Again, the goal is to talk about multiple choice questions and to try to make your test day experience as good as possible. Let's see. Oh, shoot, I put it over in the wrong thing. Hold on one second. Let me go ahead and put it over in the right thing. I see I put it in the PTA thing is what I did. All right. Those of you in the crash course, we have a bunch of you here who are part of our crash course. I am just posting those into the slides. Okay, so reload, it should be there now. All right, let's go ahead and get started. So again, we're going to talk about how to dissect practice questions or NPTE questions. I want to make sure that when you're in the test that you can see some of the tricks and tips to understanding the test question itself. And then we'll also talk about test day strategies, again, with the goal of trying to keep your mind sharp so that you can clearly recall the things that you already know and make sure that you get the best score possible. So over in the chat box, if you don't mind, are you taking the, how many of you are taking the test next week or in the January 26th test window? I recognize that from January 26th to February 9th is our January window. We've got quite a bunch of you. Awesome. I am going to speak to you guys specifically. Those of you taking the test farther down the road, say into April or into July or October, obviously these principles will still apply, but we're going to talk as if you're taking the test next week because, I mean, let's be honest, it's a stressful situation trying to get everything all ready for test day. So let's go ahead and talk about some of the things that you can do to make that experience as good as possible. All right, so let's talk about practice questions. When you're looking at practice questions, oh, and by the way, I've got some practice questions coming up. So we'll actually practice this in practice questions so that you can be well-versed in the content and be able to just rock it on test day. All right, question strategies. Let's talk about some of the things to do. So first things first, whenever you're dealing with multiple choice questions, and a lot of you have heard me say things like this before, but when you're doing multiple choice questions, the first step is to obviously start with a positive attitude. So no self-defeating, defeatist type attitude. You need to walk in there planning on success. So start with this positive attitude. Otherwise, you get into this negative feedback loop where if you begin with let's say you have a negative attitude and then you are focused or not focused, you're lost and upset about the test questions, then that leads to getting questions wrong. And so if you start getting some questions wrong or you feel unfamiliar or uncomfortable with the questions, that only further exacerbates the cycle. And so you get into this negative feedback loop. So therefore, you need to start with a positive attitude. And I know this is super cliche, but as best you can, try to give yourself positive affirmations to remind yourself that you are good at this. You've been studying this for years. There is no one more expert than you at this content. So now it's time to walk in and just dominate on test day. So step number one, walk in there, have a good positive attitude so that you can make sure that you don't get self-defeating on yourself if by chance you get a question wrong or you're unfamiliar with the content. All right, so that's step number one. Start with a positive attitude. All right, step number two. This is what I call the read the question strategy. And I know it's not much of a strategy, but the idea with the read the question strategy is to do your very best to read it the first time to understand what the general idea of the question is. A second time you read it, you're looking for the key information that's contained. So this would be, there was a range of motion or a weakness or a paralysis or a diagnosis, whatever it is, look for that key information. And then the final thing, final reading of the question is to look at the stem to make sure that you're answering the question appropriately according to what the stem is asking. So which is the best, which is the least, which is the most, which is the worst. Once you've read the question and you understand what the stem is asking, the next step is to try to formulate in your mind an answer to the question. Try to formulate in your mind an answer to the question, or at least the characteristics of what the question would include. Now, I know there are some people who like to read the question backwards, who you'll read, let's say you read the options first and then the question so you know what to look for. I really only recommend that with image type questions. My brain just works better in reading it, read the question, understand what it is you're looking for, try to at least formulate or theorize about what the correct answer would include, and then make sure to read all the options before making a selection. So a good example of this is if you're reading a question and it's, let's say that the question is about someone who starts to display signs of autonomic dysreflexia, the formulation or the answer that you could come up with, even without looking at the options, the answer is probably going to be something about sitting the patient up, or something about checking the catheter, checking for any sort of noxious stimulus. And so then you can identify that among the options. Again, the goal being that you're going to read the question thoroughly, formulate an answer in your mind, and then finally read all of the options before making your final selection. Now, you could go at it stepwise. I have had some people do a stepwise process where they come to option number one. Option number one, you either rule it out with a rationale or you rule it in with a rationale. And so you go stepwise through each of the options, either eliminating them or ruling them in as a possible answer. And usually you can narrow things down to 50-50 at that point. So this is related to what we just talked about, but creating a mental checklist in your mind, trying to see what the characteristics of the answer would be. And so this is when you're trying to formulate that response in your mind. Sometimes it's good to at least identify or underline the keywords in the question or in the stem of the question, just to make sure that you are clearly lining up with the correct diagnosis. So for instance, let's say someone has arthritis. So that's one of the things in the question. They have arthralgia or some type of arthritic pain in their joints. Let's say it's in the knee joint. And then it goes on to describe further that they also have skin rashes or a silvery scale type skin rash on their elbows and knees. If you were to just look at the arthritis, you maybe would be guessing, because you're like, okay, is it reactive arthritis? Is it psoriatic arthritis? Is it osteoarthritis? Is it rheumatoid arthritis? But if you look at the other bits of information, that helps you to narrow things down. Say, okay, yes, arthritis is common for all of those. But with psoriatic arthritis, you get the skin lesions or the silvery scales, especially on the knees and elbows. You start to say to yourself, okay, that sounds more like psoriatic arthritis. And that gives you clues as to what the correct answer is. And then remember, if an answer option is partially incorrect, or if there are incorrect features of the answer, then it is totally incorrect. So if it's partially incorrect, then it's totally incorrect, and you can immediately rule that one out and cross it out. There's a strike through option on the test. So if you need to strike through so you can more easily visualize which answer options are still eligible, or at least in your mind, use the strike through option. It has no bearing on your score. It's just for your ease of navigating the test. And then remember, there is no penalty for guessing on the test. So if all else fails, put down your very best guess and make sure it's your first guess, or your intuition. You could call it the gut feeling. Use your gut feeling to try to identify something that maybe is in your subconscious. And that's why they say go with your first guess, because usually your first guess has taken you in the right direction, even if you couldn't articulate why it did. There's no penalty for guessing. No matter what, before you move on from that question, always make sure you put down a guess, go with your gut, and then don't change your answer unless you want to get it wrong. All right, so this is, and just kind of going on off of what we were just talking about. So what if you don't know the answer? So this is a tricky one, because clearly knowing the answer is the best way. And I get people asking me all the time, Will, what's the secret to passing the NPTE? Well, the secret is just getting all the questions right. It's no different than playing basketball. The secret to winning a basketball game is to just score more points than the other team, right? But it's not as simple as that, especially when you run into topics that are unfamiliar, or maybe, in fact, I wouldn't even say maybe, you will run into test questions that are unfamiliar, or maybe they're testing you on something that exists, but you're not quite sure of. So for instance, if the test were to ask you a question about phase 1 cardiac rehabilitation and the sub-levels of phase 1, so there's 6 sub-levels of phase 1 cardiac rehabilitation. You're like, okay, I know stage 1 is bed rest, stage 2 is in-room ambulation, stage 3, you're starting to walk out of the room, 4, 5, 6, you start progressive hallway ambulation. But let's say you didn't know that. So what would you do? So the first step is to identify what body system. So even if you don't know the answer, try to identify or articulate what body system it is we're talking about. Is it cardiac? Is it metabolic and endocrine? What in the world is it as far as the system? And then try to identify what it is they're asking you to do. Are they asking you to do an evaluation and differential diagnosis? Or are they asking you for an intervention? Try to again, take it to that level of what system are we in and what stage of rehab are we in? So here are just a couple of tips, again, if you don't know the answer. If you don't know the answer, look for the longest option or the one with the most words in it. Often what the writer has done is tried to qualify or to put more detail into an answer option. Now, on the NPTE, it's unlikely that they let a lot of these slip through. But if you have zero idea of the correct answer, look at the lengthiest answer, just the most number of words, and at least pay close attention to that. Say, okay, is that the most qualified? Does it have the most data in it that would then make it more likely to be correct? Again, it's not always the case, but just pay close attention to the longest item. If you can, try to eliminate any outliers. So this would be an overly optimistic answer option. So let's say that a person is experiencing multiple PVCs during cardiac rehabilitation. One of the answer options would be to continue with the activity without modification. That's an overly optimistic answer, and you could usually eliminate that one because it's an outlier to the case. And the more you can eliminate, the higher likelihood you will have of getting that question correct. And then if you can narrow it down to 50-50, at that point it is just a guess. But again, look for the lengthiest answer option. Look for what your gut tells you or your intuition leads you towards. If you can narrow it down to 50-50, identify the body system, the stage, or the characteristics of the rehabilitation phase you're in, then that helps guide you even farther to making a more educated guess. Because I get people all the time asking me, okay, Will, yes, I can narrow it down to 50-50, but what do I do? How do I get the 50-50 down to the correct answer? So obviously knowing the content is a good way to identify the correct answer. But if you don't have that, if it's something you don't remember, try to eliminate everything you can. You get down to 50-50, look for the lengthiest answer option, look for the one that's usually not overly optimistic, or another one that they'll sometimes put in there is abdicating care or a referral when it's not warranted. So very often these are cases where it would be wise to collect more data before making your physician referral. So things like that can help you identify and make a better decision when it comes to the 50-50 questions. Another thing that they like to test you on, it's tricky because it'll be tempting, but they'll try to get you to skip steps. So as always, you need to start with your detailed history. When you're doing an examination, you need to understand what's going on. You need to understand not just the patient's name and age, but you need to understand the precipitating factors, the aggravating factors, the alleviating factors. You need to know if they just had a spicy lunch or if they just hiked up a hill to get into the clinic. Try to get as much information as you can verbally before you dive into your physical exam. So it usually goes in this order: detailed history with review of systems, followed by visual observation, range of motion testing, strength testing, neurologic testing, special testing, and finally to functional and psychological testing. So just keep in mind that's the natural order of an exam. And then don't treat until you've completed your exam. So that's another one that they love. I've seen a bunch of therapy ed questions about this where they hint at a diagnosis, but they haven't given you the full diagnosis or the full data yet. And so one of the answer options is a correct intervention for the hinted at diagnosis, but you haven't gotten that far yet. And that's what they're testing to see if you would continue to gather data that would help make your diagnosis even clearer, stronger, or perhaps do some differential diagnosis. So does that make sense when I say don't skip steps, do your examination and complete it before jumping to your intervention? So that's a real key. Do your examination before jumping to intervention. Obviously, the more you know the content, the firmer grasp you have, the easier it'll be. Most of you who are taking the test on Tuesday next week, or between Tuesday and Friday, it seems like that's the most common test date. Between Tuesday and Friday next week, at this stage of the game, you're not going to be learning new content, so to speak. You're going to be reviewing all of the old content you've been working with. So as much as you can, try to keep it fresh for test day. So just a few more tips as we've already talked about all these, but if all else fails, put your best guess down. Remember, don't worry about patterns in the test questions. They are totally randomized. If you can eliminate 3, that's the best, because then it leaves you with the correct answers. So try to eliminate 3 as much as possible. I mean, ideally you just look at it, know the answer, but if you can eliminate 3 and have one clear winner, that's, winner, winner, chicken dinner. The other thing you'll see is sometimes they write questions with opposites in the options. So if you can eliminate 2 of the opposites, then that narrows it down to 50-50. And again, increases your likelihood of getting that question correct. All right, so any questions so far? Questions or concerns? Or maybe while you're thinking up questions or concerns, I'm going to ask you guys some questions. All right, so here's your first question. I just opened up a poll box. You should see a poll box. Please click in your response. I'll be quiet while you answer. 72 seconds, ready, set, go. All right, we'll go for another 10 seconds. Another 10 seconds. All right, and time. So this is a good example of opposites in questions. So you can see that we have a physical therapist is performing accessory motion, testing a patient who exhibits painful active elbow range of motion that is severely restricted in pronation at the proximal radial ulnar joint. So we see that we have exhibits a painful, so there's some keys here. So we're doing motion testing on a patient who has a painful elbow extension, so this is key, that is restricted in pronation at the proximal radial ulnar joint. All right, so we've got a painful and stiff proximal radial ulnar joint. Which mobilization would be best to address this patient's impairments? So you have to ask yourself, okay, what are we going to do first? What's the first step in trying to restore active wrist pronation due to restrictions at the proximal radial ulnar joint? So now as we look through the answer options, we see that there are some opposites. So an anterior medial glide and a posterior lateral glide. So we've got 2 opposites here. And then you can see that it is further challenged a bit with large amplitude versus small amplitude. And then it also has within the range of motion, the end of the range of motion, and the beginning of the range of motion. All right, so when you look at all that, you see that each answer option contains a bunch of information, and they love to write questions like this because each answer option contains a whole lot of content. And so which one of these is the correct answer? So if we're trying to limit or trying to improve wrist pronation, especially if it's painful, and this is the key modifier here, a painful elbow range of motion with wrist pronation, the posterolateral glide with small amplitude oscillations at the beginning of the range of motion is your first step. And honestly, when you're doing range of motion intervention, or sorry, not range of motion, when you're doing joint mobilization interventions, you almost always start small, low and slow with your grade 1 and grade 2 Maitland mobilizations. So in this case, we're talking about grade 1 and grade 2. They're used to treat the pain and muscle guarding that's often, or that is identified here, that we have a painful active elbow range of motion, and it will start the process of getting us into more pronation by reducing the pain and muscle guarding. The other thing you need to know is that the proximal radial ulnar joint, we see that it's the radius that is the convex portion of this joint. So as you're rolling from supination to pronation, you're getting an anterior roll, which requires a posterior glide. So that's why number 3 is the most correct answer. It includes the posterior glide with small amplitude oscillations at the beginning of the range of motion, or a grade 1 Maitland mobilization. Good. Any questions about that? Any questions about that? And most of you got that one right, which is fantastic. So again, this was a good example of opposites that are contained in a question or in the answer options, and then making sure that your intervention directly addresses the problems described in the question. I like that. So Shannon over in the chat box saying, for this joint, I use SAM, supination anterior medial, and people, or PPL, pronation posterior lateral, if that helps anyone. Awesome. And then Philip talking about the distal radial ulnar joint. Yes, distal radial ulnar joint would be opposite, meaning that the proximal is convex moving on concave. The distal is concave moving on convex. That's exactly right. All right, let's do another one if you're up for it. Here we go. Relaunch. All right, 72 seconds. I'll be quiet while you answer. Ready, set, and go. All right, about 10 more seconds. 10 more seconds. All right, and time. So this one's definitely a little clearer, talking about a 55-year-old patient who mentioned she's experiencing a surreptitious onset of pain, or so a sneaky or kind of insidious onset of pain to her left lower back that spreads to, so we've got left low back, spreads to her ipsilateral groin and ipsilateral shoulder, but does not radiate into her lower extremities. So you can see we've started to describe some visceral pain. You see that it's not necessarily onset by motion or activity. Rather, it's this insidious, slow onset of pain. The patient dances twice a week, states she sits at her desk for 8 hours a day to perform secretarial occupation. Upon examination, the patient's comparable pain is reproduced with percussion at the T12 costovertebral angle. So We are at the T12 cost over T ruling. Which of the following is most likely cause for this patient's signs and symptoms? So we've got left pain, ipsilateral groin and shoulder. So things are all on the left side. Everything points towards the left kidney. Left kidney, that is the correct answer. That's surreptitious onset of pain. The farther down the urinary tract, let's say you had a kidney stone. So a kidney stone often presents as colicky type pain. And if it's all the way up in the kidney, the pain will be a little bit higher. So up in the low back region, maybe down to the groin. As it travels down the urinary tract, you can get pain extending farther down into the medial thigh. So just something to watch for. The farther down the ureters and finally to the urethra, the farther down the pain will also present. So we've got left kidney pain. Let's see, I think most of you, here I'll share. So most of you got this one correct, which is awesome. The most popular incorrect answer is the gallbladder. Remember, the gallbladder is on the right side, so right upper quadrant pain, but it can also result in a referred pain pattern to the, let's see, we've got it here, the right shoulder, between the scapulae, tenderness on the tip of the 10th rib, and other types of gastrointestinal distress. So we've got vomiting, nausea, anorexia, jaundice, and low-grade fevers and chills. All these indicate a gallbladder. And then the bladder, often the pain is very down by the bladder. So suprapubic or perhaps low abdomen, low right or left, lower quadrant pain, possibly low back pain, especially if you consider if there's a kidney stone just entering the urethra. Very often these folks will present with low back pain as well. Nice. Very, very nice. Okay, so that one's definitely clearer. Any questions or concerns about those? Another thing to watch for, look at the description of the pain. So usually if we're talking musculoskeletal pain, it will be exacerbated with movement or some type of positional change. When it's visceral pain usually has a slower onset. It's more, they call it deep or boring pain that's unrelieved with motion or movement or activity. So yes, that was a tough question, Christian. Definitely a tough question, but I don't want to throw you too many softballs here. I'm trying to get you ready, jazzed up for test day. Most of you taking the test next week. All right, let's talk a little bit about some strategies to reduce anxiety and stress on the day itself. So when we're talking about test day strategies, one of the things you have to watch out for is test fatigue. So test fatigue really kicks in. You mean you're in there for 5 hours. Any of you who have test accommodations, you'll be in there for 7.5 up to 10 hours sitting in that seat. So how do you avoid test fatigue? So it's a little bit late to make this schedule, but those of you who are scheduling down the road a little bit, just remember, try to schedule your test when you're most awake or active. You don't always have this option, but if you can test in the morning, you're a morning person, do that. If you're an afternoon person, test in the afternoon. Do your best to schedule when you're the most active and then practice during that time period. So again, those of you taking the test next week, unlikely that you're able to change your, well, it's not just unlikely, it's extremely unlikely you'll be able to change your test time. So as far as how to avoid test fatigue, other strategies include get plenty of rest the night before the exam. So this one, I always say very, tongue in cheek on this one too. How many of you, just by raise of hands, or you can chat in, how many of you have a hard time sleeping the night before a big exam? If you're like me, I just can't do it. I can't sleep the night before. I took my OCS exam 2 years ago, and the whole night I was having nightmares about, car breaking down to the test center, sleeping through my alarm. And, there's just one of the, this is so silly, but if you're worried about sleeping through your alarm, drink plenty of water the night before. Obviously, good hydration is great, right? But it'll prevent you from sleeping through your alarm because you'll be getting up to go to the bathroom all the time. So my biggest recommendation is get plenty of sleep 2 nights before the exam so that you can survive on less than ideal sleep the night before the exam. So do your very best to get plenty of rest. And this includes good exercise, good natural lighting, spend some time going on a walk, brisk walk, whatever it is. Try to nourish yourself so that you are at your peak performance. So that also includes appropriate hydration in the days before the test. So good nutrition and hydration in the days before so that you are at your most awake, most active time frame. All right, so CJ asking a very good question. What about what about snacks on test days? So you do have a scheduled test break between section 2 and 3. And that's where the clock stops for 15 minutes. And this is a great time to get a drink of water and a snack. Remember, sugary snacks are not, you'll crash if you go off. If you take a sugary snack, you'll get hyped up on the sugar for a while, then you'll crash a while later. So try to choose things that have proteins and fats. So fiber, this is why trail mix is everyone's favorite, because you got the protein in the nuts, you've got the fiber in the fruits, a little bit of sugar and fat in the chocolate. I mean, it's just the perfect mix for a longer term type energy, as compared to my son's been reading Calvin and Hobbes lately. Any of you are Calvin and Hobbes fans? I think Calvin's always eating sugar bombs. So if you're just having a bowl full of sugar bombs, that's going to be bad news. Let's see. So eggs definitely on the list. A lot of you mentioning eggs, boiled eggs for sure, jerky, nuts, fruits. Exactly, Nicole. So types of fruits or things with fiber in them, also fantastic. Chelsea asks, are we allowed to bring coffee in a thermos for our break? I'm going to need some caffeine. So just a cautionary word on caffeine. Caffeine is a strong diuretic, especially if you've been appropriately hydrated or even overhydrated before. Exercise caution on the caffeine. But yes, you can bring your snack and your thermos to your locker. They have to stay in the locker. They can't come into the test with you. But let's see. So Alan, I'm also bringing a meat stick. I hope the person next to me doesn't bring boiled eggs to eat. Reminds any of you who are the Office fans, you remember when Dwight's eating boiled eggs in front of everyone. Makes everyone throw up. And let's see. Other questions. So Ria, if I'll have a technical glitch for like 20 minutes the first session, can I reschedule my test? Ria, that's a great question. I don't know. So your question is, if the test center has a power outage or there's something where there's a glitch and you can't test at the time that you were appointed, can you reschedule? It depends on how big of a glitch it was. I think if it's just a quick reboot of the computer that they don't care, and they'll say, yeah, you're here to test, you better test. I had one person, I'm trying to remember. I know I had one person last fall where the air conditioning went out in the building. And so it was sweltering in with all those computers, and they said, sorry, not sorry. That's just the way it is. So for the most part, it has to be pretty catastrophic for them to schedule or negate your test or test time. So Santos asking a great question. How many days before the test do you recommend stop studying? So if you're like me, I would go crazy if I just started binging on Netflix, 3 days before the test. Rather, my suggestion is at this point, if the test is next Tuesday, the 26th, so we're 5 days out. With 5 days out, there's really no new learning that can occur. I mean, possibly, but no new learning that can occur. And so I would fill my days with things that are nourishing and good. So plenty of rest, exercise, time, quality time with family and friends. But I would go crazy if I didn't at least look at some notes. This is where a good deck of flashcards can be really helpful. One of the things I enjoyed doing was doing sets of 10 practice questions. So I do 10 questions and review the content, make sure that I was familiar with how it was asking the question and the little bit or piece of information that was the key to each question. So at this point, you need to start tapering back on your heavy duty study and start doing more of what I call casual study. Casual study is just, you're in a comfortable place, you're sitting with your feet up, somewhere, again, lots of natural light, someplace you feel comfortable in, and just kind of lightly go through the things you've already looked at. I see Lindsay brings up a good point. The FSBPT website says that if the delay is longer than 60 minutes, then you can reschedule. If it's less, then you're still expected to sit for the test. Yeah, that's about right. Julianne asking, if the markout option is not available, can they restart the test to provide that option? If the markout option. Yeah, if they need to restart the thing, then if they need to restart the test, then they'll restart it and it wouldn't count against your time. I see Adam asks a really good question. How do they confirm there will be no students who have been exposed to or tested positive for COVID at the test center? That's a very good question. I think they treat everyone as if everyone walking in the door has COVID basically. So you have to mask up. They don't let you touch anything. So everything that you do touch is disposable or has to be disinfected. You have to sit more than 6 feet apart from everyone else. So limited test capacity, mask on, no congregating, no lines. So there's really no way to confirm that everyone doesn't have it. So that's why they treat everyone as if you do have it. So if that makes any sense. Let's see. So my vendor's saying, try taking your practice exams with a mask on. It is really annoying. It's terrible. Let's see. CJ, I think they call beforehand and ask if they have any symptoms. That's a good question. I'm not sure I don't think they call. Maybe someone can confirm on this. I don't believe they'll call you. I think if you are presenting with symptoms, then you would basically self-select. Let's see, Mackenzie asking, can we bring gum? So as far as I understand, you can bring gum just as long as it's not loud, you're not popping bubbles, and it's not a distraction to other test takers. And it'll be in the mask. It'll be annoying, but I guess if you like having the gum with the mask on, I mean, that's the nice part. You can just spit it out in the mask and so you'll be all set. See, Megan saying Prometric Center calls you to confirm you don't have signs and symptoms or have been exposed. Right, so Prometric Center may give you a call. Again, it may depend on the state and the test center because each state has some slightly different guidelines. All right, so another thing that contributes to test fatigue is eye strain and mental fatigue. So clearly eye strain, this is a big part of staring at the computer for 5 hours straight. So the recommendation is every 20 minutes, take 20 seconds and look at something that's 20 feet away. So idea is to try to rest your eyes so you don't over focus or strain your eyes. And so I've got a friend of mine who's an optometrist, and he says that there's a difference between looking hard and looking soft. So if you're focused sharply on the monitor and you never look up, your eye muscles fatigue, and it contributes to headaches. It can contribute to that overall feeling of fatigue. It's just like any of you who've gone on a long late night car ride or car drive, you'll know that from staring at the road so hard, watching for deer and cars, whatever, you'll know that you're fatigued, even though you've done nothing physically. That mental fatigue really kicks in. So every 20, 30 minutes, take a mini mental break. I like to call these mini mental breaks. Rest your eyes, take a couple of deep breaths, meditate or pray. Do something that calms you and gets you ready to dive into another 20 or 30 minutes. So test anxiety, this can kick in, especially, I don't want to create anxiety by talking about anxiety, but the idea with test anxiety is that we tend to be anxious about things we can't control. So that's the name of the game on test day. You can't necessarily control what questions you'll get. However, you'll try to create as much control as you can of the whole situation. So this includes getting to the test center on time, making sure you have a good plan. So obviously studying efficiently plays a big part of this, but do your best to learn about the test, learn about how to get to the test center, how many number of questions there are. Learn everything you can about the test environment so as to reduce your test anxiety. The other thing to do, and this is our first slide was about it, talking about being positive, but just plan on passing. Remember that you're good at this. Tell yourself you've studied this for years. There's really no one better at this than you. And it's time for you to go in and just execute on test day. So if any of you do have severe test anxiety, it's too late to get accommodations for January test, but any of you who are targeting on or beyond the January test date, if you do have severe test anxiety, get the appropriate help. Just, it's important to get accommodations if you need accommodations. All right, so let's see, just some questions. Allie's asking random question, but how long will this session go tonight? We'll go to about the hour mark, so we'll go probably for another 15 or 20 minutes, depending on questions. No, let's see. Brittany's saying no one is better at this than me, except Will Crane. Well, thank you very much. I appreciate that. But I've been stumped on so many questions before. It's just remember, you've studied like crazy for this, and it's just time to go in and show it on test day. All right, so just a couple of things I want to talk about, specifically about the test day. So we talked about, so I have a couple of things, again, for people who are down the line taking the test. I know I have a few April test takers and July test takers. Just try to be consistent in your routine. And it's the same even between now and Tuesday. Try to be consistent. Wake up at a time that you expect to wake up on test day. Spend your days like you would be spending on a test. You have to get up at 6, then get up at 6 every day. Try to get into the routine before test day, and then limit the time you spend worrying about the test. If you find yourself lingering on thoughts of worry, try to think of, I mean, this is a Peter Panism, but try to find your happy thought. Think of something that's more interesting, or something that I do. Like I've memorized some lines to, like, I know a lot of lines of Shakespeare, and I know a lot of scripture lines, and I try to think of things that I've memorized before and make a list, or try to think through something else. And that usually does a good job at either helping distract me from what I'm worrying about, or in the case of insomnia, it helps me go to sleep, just because I'm focusing on things I've already thought about and have memorized to a certain extent. All right, so let's talk about, again, I want to talk about all this stuff. So nourishing yourself, we already talked about most of this stuff. Make sure to get a good, healthy sleep cycle, good nourishing foods, get plenty of sleep 2 nights before the test. If you do need help on the test, be sure to seek out appropriate accommodations. We talked about focusing, the mini mental breaks, we talked about all that. All right, so let's talk about time. So on the test, I think we're all familiar, we're talking about the NPTE for physical therapists. So those of you who are PTAs, this is slightly different. But for PTs, there are 5 sections on the test. 1, 2, 3, 4, 5. You get a scheduled break after section 2. So scheduled break, this means that the clock stops for 15 minutes. 15 minutes where the clock is stopped. And remember, with all the social distancing and the lines, and you have to disinfect in and out, it takes like 5 minutes to get out and 5 minutes to get back in. So really, this is only a 5-minute break. Just lock in your mind, this is really only 5 minutes. Quick snack, quick bathroom break, back into the test. You're allowed to take unscheduled breaks between any of the sections. So as you're taking the sections, you must submit each section before moving on to the next. So section 1, you complete those 50 questions, submit, and move on. Section 1, section 2, take a scheduled break. Section 3, 4, 5. If for some reason you need an emergency bathroom break, that's what the unscheduled breaks are for. Now, the unscheduled breaks, the clock does not stop. It means every second you're out of the seat is a second taken away from your test experience. So you've got 5 hours. So we're talking normal time. You've got 5 hours to take 5 sections. So you should have about 1 hour per section. So I don't recommend timing each individual item. Rather, I suggest that you time it in bigger chunks. So at every half hour, you should have completed 25 questions. And use it in that type of increment so you know if you're a little bit ahead or a little bit behind. So Nicole says, mentally, I look at it like I'm going to see 250 patients, and all the cases will be interesting to tell my mind I'm not taking an exam. That's a good way to put it. Really good way to do it. See, over in the Q&A box, Christian asks, do you advise taking 10 questions per day on the last week of the exam, or just chill study? I would do both. So just speaking from my personal experience, when I took the NPTE, in the days leading up to the test, I took fewer and fewer bigger tests, and rather I focused on small sets of questions. So 5 questions. In fact, I had the Score Builders app, and they let you take, I mean, you can take as many questions as you want. And I had already been exposed to most of the questions. So I just picked 10 out and review 10 and be like, oh yeah, I remember that content, or yeah, that's a tricky one. I need to make sure to remember that. So I do advise casual, chill studying, which can include some low stakes quizzes, a few questions a day. That kind of a thing can be fantastic. Let's see. Janice says Amazon Prime has good suspense movies that distract you between your mini questions. So yeah, And I don't think I have anything in here about some of those things, but you tend to avoid stressful things in the week before the test. So like, I got to tell you about this last fall, and I don't think she's here with us today. If she is, we'll try to preserve as much anonymity as possible, but it's amazing how many stressful things can add up on test week. So as a general rule, I tell people don't move apartments or houses in the week before the test or in the month of the test even. Don't break up with your significant other if at all possible. Don't break up. Let's see. Don't get sick, and don't let any of your family get sick, and make sure you have plenty of money in the bank account. So I had this one person who bless her heart, she got sick. She had a severe illness that was really life-changing. She got sick. Both of her parents and grandparents were sick. I think some of them had COVID. She had a major cross-country move. She just broken up with a longtime boyfriend, and she was depending on her parents for financial support because of everything that was going on. It's like, oh my goodness, I don't know what else could possibly go wrong. And well, I take that back. I do know of a few other things. Like I had one guy, this was a few years ago. He had planned what he's going to wear on test day, even down to his favorite pair of shoes. And the night before the test, someone broke into his car and stole his favorite pair of shoes. And so as much as you can, try to control as much as you can, have a plan B just in case. Anyway, yeah, Murphy's Law really kicks in. So control as much as you can. Take a good scheduled break at the scheduled break between sections 2 and 3, 15 minutes, and then dive back into the test. All right, other things on test day. This is just all about having a backup plan. So how are you going to get there? How long does it take to get there? You need to get there early, but not too early. So if you're in the parking lot 3 hours before the test, that's too early. If you're walking into the test center with 3 minutes to spare, that's too late. So 30 minutes is a good target, just in case there's a little traffic. It depends on traffic situations wherever you are. Like in my case, I had to drive 90 miles to get to my test center. And so I was up at the crack of dawn driving, and I got there 45 minutes early. It was a little stressful. I tried to relax and study a little bit in the car, but you don't want to get there too early. So have a good backup plan, know what you wear. So this is one, dress to impress. There's a huge correlation between how we feel about ourselves and how we perform. So for instance, if you're looking like a slouch walking in, unshaven and unkempt, you just don't perform as well. So dress to impress, dress business professional, get in there ready to show them that you're the best therapist there ever was. Another thing that I don't have a slide about it, but try to have a good posture throughout the experience. So if you're sacral sitting in a defeatist position versus being an upright, shoulders back, chin up type of position, when you're more engaged with the environment, there's an actual physiological response, and it's worth doing. If you're looking for all the little, getting every point possible on the test, shoulders back, sit up straight, and be engaged with the test. Nicole, wear my red power shirt. Yes. If you're into power shirts, power ties, make sure to, again, you need to look the part, walk in there like you own the place. See, Brittany brings up a very good point. Take a sweatshirt. I find it very hard to concentrate when I'm freezing or have to pee. Yes, so it's hard to, again, things you can control is having a light jacket with you just in case, because let's be honest, you're dealing with computer equipment. Anytime you're in a room with computer equipment, a lot of times they have the AC turned up to help the computers run better or to compensate for all the heat they're generating. So it is likely that it could be uncomfortably hot or uncomfortably cool. So be prepared. Let's see. Kathleen saying, make sure to empty your pockets. Yes. This is about 4 years ago. I had a student who she made it into the test center with a hoodie on. She was wearing a hoodie, and her iPhone was in the pocket of her hoodie, and she forgot about it until she was in the test center, and she puts her hands in her pockets and she feels her iPhone. And this is the part where you're all going to say, no. And so she used her iPhone as a timing mechanism while she was taking practice tests. She thought, oh, I'll just do that here. So she pulls out her iPhone and starts using the timer feature on it. Like, no. So the proctors saw her doing that. They discontinued her test, and she got a suspension from taking the test for 2 years. She's like, oh, empty your pockets, empty your pockets. Make sure your pockets are empty. Oh, I've got stories. There are lots of stories. See, Brittany asks, serious question. Can we wear gloves? My hands are always cold. Brittany, no one's ever asked me that one, if they could wear gloves. I don't see why not. My guess is that there's no policy. They certainly have to check them, make sure they're not hiding anything, but I don't believe there'd be anything there. Let's see, Sarah, make sure you don't wear jewelry unless it's a wedding ring. They make you take them off. Yes, especially large bits of jewelry, just again, trying to prevent cheating or cameras or anything like that. Let's see, they made me take off my hairband, take off my headband to keep my hair back. Keep your dress simple and less pockets, the better. Michaela, any idea if I can bring my lumbar roll in? I sound like such a PT. I don't think so. Pretty sure they don't allow anything other than your person and a light jacket in there. Your person, not your purse, your person in there. Yeah, see, Kathleen, they even check the underfold of your pants and sleeve. Yes, they have you pull down your socks, pull up your pants. Yeah, anything, they want to make sure nothing is hidden anywhere. Let's see, can you wear a jacket with pockets? Yeah, you can wear a jacket with pockets. Just make sure that you have emptied said pockets because they will check. No hair ties on your wrist either. Yep, exactly. See, Jose saying probably can get away with gloves during COVID, especially latex gloves. They're surprisingly warm. That's a very good point. Very, very good point. I see Christian asking, can you tell us what you did a week before your exam day and leading towards the day of the exam? So when I took the exam, just my personal experience about taking the exam, in the days leading up to the test, I had a whole deck of flashcards that I'd spent working on for several weeks before. I had the Scorebuilders app, which included practice questions. And I didn't have PT final exam at that point, which is why I started PT final exam. But I had practice questions, I had my notes. And in the days leading up to the test, I spent time sitting in a comfortable chair, spending more time, like 5 days before the test. I was probably spending 3 or 4 hours a day studying. And then the day before the test, I only spent like 1 hour studying. So kind of a tapered down approach over the 5 days before. See, Lillian asking, is the 5 hours broken down for each section of the test? If so, if I'm done with one section with some time left, does that time get carried over to the next section? But that's such a great question. And I didn't mention it earlier. The 5 hours is the bank of time to complete all 5 sections. So this is your target, but it's not a limit. So realistically, you could, if you wanted, it doesn't make any sense why you do it, but you could spend all 5 hours on section 1 and then 1 minute on all the other sections. It would be a terrible thing to do, so don't do that. So your 5 hour time is a bank of time you can use as you wish. You're not limited to 1 hour per section. Rather, it's a full bank of time. Does that make sense? Did I say that clearly? The 5 hours is the bank of time that can be used for the whole test. It's not broken down. It's the same thing with the score. The score of the test is not broken down. Like, they don't care if you pass section 1 and fail section 2. They look at the global score. That's the score you get. Let's see. So Kelly asking a question over in the Q&A box. Do you prefer, if you have test anxiety, do you prefer if you take the early exam? I read in the Scorebuilders book to take the exam early. Take the early exam if you're nervous about the test. So Kelly, I think most people prefer the 8 a.m. test window. So taking the test earlier in the day. I know I do, because that's when my brain is more awake and alert. I get the afternoon sleepies if I take the test at 1, which is why I didn't. I tried to take the test at 8 o'clock. See, Connor just tuned in. Sorry, late because of work. Will this recording be posted? Yes, absolutely be posted. All right, so we talked about hydration, but be careful of caffeine. Have a good backup buddy just in case. And once you're in there into the test center, like, just start. Just make it happen. Make it happen. You walk in. In some ways, I get tunnel vision when I walk into the test center. Tunnel vision where I hit question 1 and I'm like, okay, I'm here. I'm ready to go. Just dive in and start answering questions. Now, don't rush through them, just answer them appropriately, but dive in. We talked about this earlier today in our small group classes. We talked about brain dumps and some of the things that you could put on your brain dump. There's an irony about the brain dump. The brain dump is on that sheet of basically the scratch pad. You can jot down a few notes, not before you go into the test, obviously, but once you're in the test, you can jot down a few things. The irony of the brain dump is that you've already memorized it. And so to write it down on the brain dump, you've already got it memorized. So the likelihood of you needing it is very low. However, there is a psychological effect of having that information in front of you, and you won't forget it because you've written it down. So it has a good positive boost on your attitude. So brain dump can be very useful. We talked earlier today about some suggestions to put on there, like lab values, cranial nerve tests, fun acronyms. If you can't remember a certain joint, like if you have trouble with proximal and distal radial ulnar joints, or Maitland mobilizations versus Kaltenborn mobilizations, it doesn't really matter because the likelihood of you needing it is very low because you've already memorized it. So Adam asks a good question. Do they provide the pieces of paper for us? Yes, they provide, I believe with COVID, it's 2 pieces of paper and a pen. In pre and post COVID, it was a dry erase pad. So they'd give you a dry erase pad with a dry erase marker, and they would erase it and clean it for the next person. But I believe with COVID, they give you the pen and they throw away the pen and the paper when it's all done. Let's see. So Katie, we talked about the brain dump. I know it's individualized for each person, but there are some things and common tips to do. Yes, we talked about the common things. Let's see. Juliana asks, can we use a pencil? They provide, so you can't bring anything. And I believe it's just a pen. I don't know, someone correct me if you've had them give you a pencil, but I believe it's just a pen that they give you for that. Yeah, Nicole, they just give you a pen. Yep, perfect. All right. So just kind of finishing up here, just be careful. When you're on the test, carefully read questions, carefully select options, and just don't worry about things. Like, walk in there and just do your very best. Don't get hung up if you worrying about, am I gonna pass? Am I gonna make it through? Just walk in and do your very, very, very best. All right, so those of you who are targeting, I know we have a lot of guests in here tonight. Just a reminder, any of you who are targeting the April test, we run a crash course every quarter. In fact, those of you who are a part of our crash course, give me a quick shout out. Crash course has been so much fun. Tomorrow, we're actually going over some cardiopulmonary interventions. We're doing EKG. We're doing some practice questions on Saturday. The crash course has been fantastic. And remember, if you get in there early, so our early bird specials usually end a few weeks before. See, crash course has been extremely helpful. Crash course has saved me. It's amazing. Yes, thank you. Thank you. I appreciate it. But we try to go over the content you need right before test day. So we've been going over tons and tons of content. And so we're going to start up our April crash course. We'll start that up. I didn't put that on here. We're starting April 5th. So again, those of you targeting April, we're targeting down there, just down the road just a little bit. See, Janisa says, crash course is great. My score went up 5% already. Awesome. I just got an email today from a PTA student who they just got the PTA results in. She got an 800 on her PTA test and attributes much of it to our crash course because we went over so much of the content right before exam day. So crash course, we do 4 sessions each week. So 3 weeks, 4 times each of these. So we do an examination, differential diagnosis, interventions, and practice questions, all as a part of the crash course. It is fast. It is a very fast, quick review in the 3 weeks before test day. So those of you who need a little bit more, I also do a full live course. This last course, we did 50 live sessions. We were able to go slower through the content, make sure everyone's questions were answered. I know I've got a bunch of you who are a part of our full course here as well tonight. And I don't know, I feel like it's so much fun to go through things at a more manageable pace. So this one, we're starting on February 15th. Let's see, February 15th. I can't even spell tonight. Feb 15th is our start for our full live course. We'll have about 50 live sessions. You get one-on-one calls with me. We do small group sessions where you usually only have about 20 to 30 people there. So we get every question answered, we take care of everyone, and we make sure that you get all of the content rather than just a very smashing crash course. So Corbin asks, good question. Is it for PTs or PTAs? It is for both PT and PTA. For the crash course, we have a PT version. We also have a PTA version. I know there are some of you here who are planning on taking the PTA test down the road in April. We also have a PTA version as well. So Connor asks a good question. When is the latest date you can sign up for that full course? That'll be February 15th. That's the latest date. We'd love to have everyone in. I mean, if you sign up late, we'll make accommodations. We record everything just in case you need it. Let's see. So practice on Saturday. See, Megan, it was so helpful to be part of the full live course. The content, Will, and other instructors were amazing. Yes. I love it. It is a little more expensive. It's $9.97, but it takes you through. We go through the whole enchilada. It's so much fun. Lots of videos. And did I mention we have 4 full practice exams? 4 full practice exams that are also included in here. It's like a $200 value, just that. So 4 full practice exams, tons of great content, world of difference. All right, let's see. So Casey asks a good question. What time of day are the crash courses held? So the crash course sessions are held at Monday, Wednesday, and Friday. That's a Friday, 8:30 Eastern on all 3 of those. And then Saturday at 9 a.m. Eastern. So this gives us a chance to go through, the Saturday session is always practice questions. So we go through a set of practice questions. And then on Monday, Wednesday, Friday, that's examination, differential diagnosis, intervention. Let's see, Nicole asks, is the crash course the same as this last 3-week crash course? So yes, much of the content, those of you who are in our January crash course, the content will be repeated again for the April course. See, Alan, I watch Saturday recorded sessions because 6 a.m. is way too early. That's right. Those of you on the West Coast, bless your pea-picking hearts. All right, what questions do you guys have? We've come to the end here. Again, good luck to everyone who's taking the test on Tuesday or this next week during the January cycle. Very good luck to you. What questions do you guys all have? What questions do you guys have? So Ali asks, is the $99 with the early bird code, or does that give a discount off? It's regularly $199, but if you sign up early, that's the 99 bucks. That's the early bird code. Let's see, Nicole saying, ready to get after this fist pump, Will. Thank you. Passion is amazing. Awesome. My pleasure. See, Mark asks, is there a link to download the slides for this webinar? Yes. Let me go ahead and post those again. Let's see. Dalton asks, where can we find the crash course for the July testing? So I haven't published the July course yet. We're just about to start April, and then we'll do signups for July in May, coming down the road here. Let's see. So Christian asking, when does the crash course start and what's included? So we're going to start the crash course on April 5th. It includes 12 live sessions. It includes all of our mini courses too. So our integumentary lymphatics and gait training mini course and non-systems. It does not include the practice exams, but you can get a discount rate on the practice exams if you grab the crash course. Awesome. Okay, guys, any other questions before we go for tonight? Yeah, those of you who are currently in our crash course, we're going to dive into cardiopulmonary tomorrow. If you're interested in jumping into January's crash course and seeing what we're doing tomorrow and Saturday, just send me a quick email. We can definitely help you out, get in there. Let's see, Casey, so the crash courses will be recorded and reviewed later. I'll be on clinicals at that time. Yes, yes, very true. Awesome, Ria, my pleasure to help out, my pleasure. So Corbin asks, I feel like I might have missed this, but is there a huge difference between the crash course and the live course? Yes. So the difference is that the crash course is 3 weeks long and it has 12 sessions. So it's meant to be quick and just a very fast course. Whereas the full live course, we have about 50 sessions. You get one-on-one time with me. You get all 4 of our practice exams. I didn't list that here, but 4 practice exams. Our full video library, small groups, sessions. We have a private messaging group that we answer questions among ourselves. So yes, we go through a lot more detail in the full course as compared to the crash course. Awesome. Okay, guys. Well, with that, let's go ahead and sign up for tonight, or sign up. We're going to sign off for tonight. Hope you guys have a fantastic evening. Those of you in the crash course, I'll get this posting recorded, and in our live course, I'll get this recording posted for you to view. And in the meantime, stay safe out there. I'll catch you guys on the flip side. Thank you so much. Have a fantastic evening, everyone.